Alright, so recently I'm thinking about medical problems when we get older. As we age, as we get older, we have all kinds of medical issues. So let's just start with myself, right? Currently, right at this point of time, I'm suffering from lower back pain. I have been suffering from lower back pain for possibly a year or two right now. And I've been actively suffering from a sciatica, which is like my herniated disc being compressed. Sorry, my sciatic nerve is being compressed by my herniated disc at my lower back, which is my lumbar region, which is around the L4, L5, S1 region, which is a very common place, unfortunately, for people to get herniated discs, right? So I'm suffering from sciatica, left leg in particular, and it sucks. I can't walk properly. I can't sit properly. I can't sleep properly. I can't stand properly. I can't do a lot of things, man. I seriously can't do a lot of things. And one of the main things that really makes me feel like shit, which is the thought of traveling overseas or maybe just long car rides. Yeah, which is like basically traveling, right? So long airplane rides, long car rides. I'm afraid, man. Because right now, even for like 15 minutes of driving or maybe 20 minutes of driving or so, the sciatica starts acting up, you know, it's very annoying. I can't sit still. I can't sit properly. I always have to be constantly shifting my ass, basically, my entire ass, my position to feel better. And I can't exactly straighten my left leg because whenever I straighten my left leg, I feel like the sciatic nerve is being pulled, right? It's being irritated. That is the feeling that I have. Yeah. So it's very annoying. So most of the time, I have to bend my knee in order to feel a little bit better. It doesn't exactly take away all of the pain, the annoyance, but it puts me in a better position temporarily. Yeah. So that sucks, right? I hate it. I can't even sit properly. Like I've bought a lot of chairs, like home office chairs. I bought so many of them, and almost none of them actually works for me. Yeah, I'm selling one. If you guys want to buy my newly purchased chair, which I sat on it like twice, right? Because I wanted to give it a shot. And then after trying for like 10 minutes or 15 minutes or so, my sciatica started to act up, right? It started to act up again. And then I decided to give it a try again a few days later. And sure enough, it got irritated again. So, no chairs for me, man. No office chairs for me. So right now I'm thinking about investing in a kneeling chair instead. You know what I mean? A kneeling chair. I'm going to try it out. Hopefully it works. Because right now I'm currently sitting on my bed. I'm sitting on my bed. I'm sitting on my mattress. I'm using it as a home office chair. Thankfully, I have a standing desk with caster wheels. So I can kind of like navigate and kind of like, you know, alter the direction, the orientation, yeah, of my desk. And it's adjustable. So that's cool. So that's very, very useful. So if you guys have back pain, please invest in a standing desk. It's a game changer, right? It's a lifesaver, especially if you work long hours on the computer. Please get it. Seriously, please get it. I stand and I sit. I alternate it, right? Obviously, you have to always be constantly changing it up, switching it up, your sitting and standing positions. Very important. Don't be too comfortable in one certain position because you might feel comfortable at a given time, but it will accumulate, right? Meaning to say that it will hurt your lower back more than you're doing good for it actually. Yeah, basically. See, I have to adjust it, right? I have to adjust. I have to adjust. My lower back is giving me problems. So annoying, man. Seriously. So this is one thing. That's for me, right? Personally. All right. So what am I doing also? That's another thing that I want to touch on as well. What am I? Because maybe some of you guys out there are experiencing whatever I'm going through. So maybe I can give you guys some advice. Yeah, because I am for sure in a better position where I was back then. Back then I was like in hell, man. Seriously, I really could not do anything. I couldn't stand straight. I had to like hunch over. I had to like bend over like the whole day. I can't stand up straight. If I lie down, it hurts like hell, right? And I can't even walk. I still remember there was one day I just woke up with that crazy shooting pain, man. Yeah, my lower back was really flat the fuck up. right? So much so that I wanted to go to a doctor ASAP at that given day. I mean, I was like tolerating throughout the entire day. I took some Panadol painkiller pills, but it didn't work. Right, and I quickly Googled the nearest doctor, the nearest clinic, but it's all closed. I recall I was really desperate at around 8 p.m. or 9 p.m. or so, and the nearest clinic was closing. Yeah, so I was like, shit, man, what do I do? Do I go to the hospital to do something about it? Right? And then I was like, nah, that's too scary. What if they just straight away ask me to go for surgery? Right? I don't want that. So I quickly went to the nearest pharmacy. I went to buy ibuprofen, whatever. That's what I got. I got the strongest one, right? And I took it. Right? Straight after that, I went for a walk because I heard that walking actually helps. I kind of like forced myself to walk to feel a little bit better, which was it a good idea at that point of time? It was bearable. It was tolerable because I was at home for the entire day, and I thought that maybe I need to walk and mobilize my spine again to rehydrate those discs. Yeah, that's what I did. I went for a quick walk, and then when I went back home, I took like 2 ibuprofen pills, and at that point of time, it subsided a little bit. A little bit was a game changer, man. I was allowed to like stand up actually. Yeah, I was comfortable enough to stand up straight, at least to do some stuff. Yeah, I was comfortable enough. Then the next following days, I just cleared the entire tray of ibuprofen. I think I consumed the maximum amount in a day, which is like what, 6 pills or so. I can't really remember. Yeah, but all I know is that I consumed the maximum number of pills because I really wanted the pain to go away. It was really hurting me like crazy. And I believe the entire course was like almost 5 days or so. I can't remember. Yeah, but I got better from pills, right? It's not really the best thing, I know. But at the point I was really desperate. I'm pretty sure most of you guys who have low back pain can understand what I'm trying to say. Yeah, I was really desperate at the point of time. So I just finished the entire box of ibuprofen. Then ever since then, I started doing more physical therapy sort of things. I started to walk more because I heard that walking helps. I swam, but for me, I don't know why, it didn't really help me, but it kind of like made it worse for some reason, my sciatica in particular. And then I started doing more physical therapy, meaning to say more low back work, more core work, the TVA, transverse abdominis, and then the external and internal obliques. And then I also trained on the quadratus femorum, and then my lower back as well. Yeah, in particular. So hyperextensions, and I did side bends with the hyperextension machine. I did side planks as well. I'm still doing them, by the way. I do planks as well. Yeah, I do ab crunches. I know ab crunches is not really the best thing, because I heard that if you were to train your core, you have to hold in a static position. It'll be more effective compared to what's it called? Dynamic movement. Is that what it's called? The exercises where you're actually constantly moving. You're not exactly holding that position. Yeah, I think holding the position is actually more beneficial when it comes to strengthening the core muscles, if I'm not wrong. Yeah, if I'm not wrong. I may be wrong. Don't quote me on this. Yeah. So that's what I'm doing these days. Yeah. It's been like, 6 months or 7 months or so. Because before that, during April, this year April, that's where I started having like continuous sciatica every single day. Before that, I kind of like recovered. I kind of like stopped. I was very happy. I thought I was like out of the woods. I thought I was cleared. I thought I was like, back to normal. I thought my life was back to normal. I was happy. I was able to do work. I was able to sit for long periods of time. I was able to do things. Go to the gym. Back to the gym. Back to my normal life. I was really happy. But that only lasted for like a few months, which is, I believe, I also went to a chiropractor last year, 2024, at around August to September period. And I kind of had pain over there, but I kind of recovered. So I believe I was out of pain for maybe just like 3 to 4 months. I believe I felt better on November or December last year. And then like I say, until April this year, that's where I started having all this stupid sciatica issue. Every single day right now. So right now, is it bearable? I'll put it this way, it is bearable, all right? On a scale of 1 to 10, maybe 3 out of 10, Yeah, I managed to put it down to 3. Although some days, I realize that if the weather is hot, I realize that it's more annoyed. Yeah, the sciatic nerve is actually more aggravated for some reason. It's more triggered. If it's cold, right? If the weather is cold, it's better. Yeah. And like if my air conditioning, if I set it to a lower temperature, right? If I set it to be cold, I realize I feel better. I don't know. Because I Googled it and then most of the time they say that it's supposed to be the opposite. Yeah. Hotter weather is supposed to be better and colder weather is supposed to be worse because your cough like compressed. You know, your blood flow is not flowing well properly, things of that nature. I don't know, man. I don't know if I'm making sense. But for me personally, that's what I experience. Colder temperatures makes it better. It's weird, man. If you guys can relate, let me know down in the comment section down below. Yeah, but that's temporary only, like I said. Unfortunately, right? It's just temporary. So walking right now, I can do it. I'm trying to do like 1 hour cardio, which is what I did earlier on. Walking on a treadmill for 1 hour, minimum 30 minutes, I tell myself. At least 30 minutes. I try to do it daily. I try, that's the main thing. But I at least get in 3 sessions per week of walking on treadmill. Yeah, sometimes I do it outdoors. It really depends on my life, right? Then I do weightlifting as well. I'm pretty much doing my bodybuilding stuff back at it again. And then as far as lower back therapy goes, right? Shout out, man. Shout out to low back ability. Brandon Backstrom, I believe that's his name. I purchased his program. I don't regret it. I do not regret it. If there is an affiliate code, I'll gladly give it to you guys. Yeah, I'm doing it every single day. Like even the days where I feel like it's flaring up, right? Immediately, I start doing that. I start doing his outer hip drop set. It's like just pumping blood, circulate the blood around my hip area. In particular, I believe it's the outer thigh, which is the gluteus medius, if I'm not wrong. Yeah, not the glute max exactly. Gluteus medius, the smaller part of your ass, basically. I believe it's the top part of your ass. Yeah, the outer upper top part. Does it make sense? Your whole ass, right? The upper part, not the below part. The below part is the glute max, if I'm not wrong. Yeah, the outer part. The upper outer part. Okay, that's it. Yeah, that's where I believe I'm training when I'm doing the outer hip drop set, which is kind of like basically you're just doing abduction work. Sorry, abduction. ABDUCTION. Yeah, so that's what I'm doing whenever I feel my sciatica is flaring up once again. And it kind of like helped me temporarily. Yeah, but it does give me relief. That's the main thing, right? It's better than popping a pill, right? It's better than taking another Panadol pill or some shit like that. Yeah, so that's what I'm doing right now. I'm doing it almost daily. That's the only hope, right? So that's my only hope. I don't want to go for surgery, right? I don't want anyone to cut open my body, right? I'm going to try all of these, otherwise they were conservative treatments first. All of these non-surgical method first. And if I'm really desperate, I might go for the steroid injection to my lower back, to the disc, to kind of like numb the nerve so I don't feel any form of effects of the compressed nerve. That's only when I'm really, really desperate. Yeah. Obviously, I want the pain to go away, but it's a long battle, you know. That's why I'm doing whatever it is that I can. All the therapy, the physical exercises that I can do to make myself feel better day by day. Sometimes I wake up and the pain's not there. Seriously, the pain's not there for the entire day. And I thought like, okay, it's a miracle. I've recovered. I'm back to normal again. And then sure enough, somehow next day I wake up, the pain came back. Yeah. So I heard from low back ability, right, Brandon. He mentioned that, you know, as long as your back, because he did mention that it's kind of like normal in a sense where sometimes you'll feel better, sometimes you will not feel better. And then you should obviously take that as a sign where your lower back can recover. Like there is hope. That's what I'm trying to say. He's trying to tell us that there's actually hope. The fact that your lower back, your sciatica, right, it kind of like comes and goes, it means that it's alive. It means that there is chance. It means that there is hope that your lower back can recover. Right? You guys get what I mean, right? Even though it's not permanent, unfortunately, I'm working towards it. But even though if it's just temporarily, it's good enough. It means that your lower back is actually like actively trying to heal as well. Your sciatica is trying to heal itself as well. So it's good. I'll take it, man. Seriously, I'll take it. Even though it's just one day, I'll take it. Right? I'm desperate, man. Seriously, I want it to go away. I really want it to go away. Even though it's just for a few hours as well, I'll take it. Yeah, so don't lose hope, guys. Don't lose hope. As long as you feel and you see some kind of improvement, there is hope. Don't give up. There is hope. Our low back can recover. Okay? Just make sure that you put in the work every single day, day in and day out. Be active. The worst thing you can do is to do nothing and just stay home and do nothing. That's the worst thing. All the more you need to be exercising, all the more you need to be moving your body. Movement is arguably the medication that your body needs. Because I'm not saying that is the only way, but the fact that you have this injury most likely is because you were not very active before that. I know obviously like people like me, right? I've been an athlete for my entire life. I'm very active ever since I was a kid. And I somehow still got injured. Right? Some cases are like me, and some other cases are like they're completely inactive throughout their entire life, and somehow they manage to not get any form of injury as well, right? But on the other hand, the more typical ones I would say, the ones who are not so active for their entire life, and then obviously you never strengthen your muscles, your body, and then that's how you herniated a disc, right? That's how you herniate a disc. So do exercises, don't give up, don't lose hope. I'm not losing hope. Although it's hard sometimes, you really want to lose hope, you want to just like give up. But then again, what's the alternative? If you give up, then what's next? What can you do? I can just say right now, okay, I give up. I give up. It hurts too much. I'm in pain every single day. I give up. Okay, then what's next? What's the alternative? What are you gonna do? You can't do anything else, right? What else can we do? When the only option is to be strong for yourself and for your family. I know there are some cases where they do the unspeakable towards to that extent. I know I've heard of such cases, but that's not the right way, man. That's not the right way. I'm suffering. We're all suffering. We're all fighting our own battles. We can only be strong, man. We can only be strong. We can't be weak, especially at this point of time. All right. So we also never know what kind of battles, what kind of illnesses that all those other people are fighting, are battling every single day, day in and day out. We never know. We just never know. Although we look normal on the outside, but inside we're not. We're not normal. I get it, man. I get it. All right. So this video kind of like turned into a personal reflection for my low back pain recovery journey. Yeah. So hopefully this video helped for some of you guys. If you guys are suffering from low back pain, from disc degeneration, disease, I have that as well. Scoliosis, stenosis, all those shitty stuff, man. I have it as well. Maybe my sciatica stopped being caused by my herniated disc. Maybe it's caused by some other stuff, which I do have as well. There's a long list of it. Spondylolisthesis, I think. I don't know. There's a lot of weird medical terms. It's all in my MRI report. Yeah. All right. So if you guys need any form of help, comment down below. I'll try my best to help you guys out with your low back journey. I'm not an expert, obviously. I'm not a professional. I'm not a medical professional. I'm not. I'm just someone who is going through this pain right now. And if I can help someone else out there, I can sleep in peace.